My name's Kate. I am the Service Development Manager at the Chinese Community Centre Birmingham. And although that's my official job title, I do anything and everything required, as most people do in small charities. So the Chinese Community Centre Birmingham was set up about 40 years ago as a self-help group initially, and it was based in Sparkbrook before it finally moved up to Digbeth. And so we've been here for about 20 years. And it helps people, predominantly older people, who can't speak English. So they face language barriers and, to some extent, cultural barriers to help access services, to navigate systems. So we're talking about health, education, housing, all of those sort of statutory services that people need on a daily basis. We also provide a social space for people because it's a migrant community. So we help people to just stay connected with each other, with culture. And support. We're going to recruit and train up a small team of community health champions. So we will then give them an induction training and then information sessions so they can share health information amongst their own family and friends networks. And that way, important health information and messages can be disseminated much more widely in the community. So we were inspired and motivated by a couple of issues. One was during COVID. We worked with Public Health, Birmingham Public Health, to disseminate information and key public health messages about COVID. So that gave us a model for this project. And then during COVID, because we had to close down as a community centre, we couldn't have people coming in. So a lot of people then stopped coming in and haven't returned. So health talks that we used to do, were less well attended. And we felt that if we recruited a small team, gave them information from credible sources, and then they could share that information out, it would reach a much larger number of people in the community. Well, we hope that people will be able to take better care of their own health, so therefore reduce the need to go and see GPs and hospitals. And we want to do that through the health champions, providing more information about causes and symptoms and so on. Because we think if rather than just pass on public health messages, if we actually give a little bit of education as well, if people better understand what's going on, then it will help them to make informed choices. So there should be an improvement in health.